We're going to get started right now. So thank you. And we want to thank everyone for coming. To make sure you're at the right place, this is a listening session. It's the fourth out of 5 listening sessions that we've had around the state for the Commission on the Future of Transportation. I'm going to, in a minute, ask each one of our Commission members who are here to introduce themselves briefly. The topic for this session is land use and demographics. For each one of the 5 sessions, we've focused on a different topic. The next session is on climate and resiliency. The work of the Commission is we've chosen to take it into 3 pieces. The first, Eileen, we need to get a space for you. Okay. The vice chair just came and she's refusing to come up to the table. We're doing the work in 3 pieces: a key topics, facts, trends, and issues piece. The second piece is focused on the development of scenarios for the future. Our time frame is the year 2040. It's not 5 years from now. It's not 10 years from now. It's 20 plus years from now. So it's an extraordinarily different kind of an effort. And the work that we're doing is broader than transportation, although transportation is the theme. Today's session focuses on land use and demographics. We're looking at the impacts of electrification. We're looking at the impacts of automated vehicles, electric vehicles. We're looking at the impact of climate and resiliency altogether. The governor has asked that we provide him our report, including recommendations, by the beginning of December, and we'll be starting that piece of our work soon. Let me just spend a minute about what this work is not about. We are not going to weigh in, nor do we want to really hear about specific projects. We're looking at the year 2040. We're looking at the overall dynamics between now and then, but not about specific projects. And while we will be aware of and we want to comment on the financial implications of what's happening, this particular body of work isn't a financial analysis report, although we will be commenting on the financial implications of our recommendations. Each of these listening sessions has started with speakers. For the most part, they've been from the UMass system, and they've been terrific. We have 2 speakers today that I'll introduce in a moment. We'll ask each of the speakers to talk for about 8 to 10 minutes, and then the commissioners will have the opportunity, if they wish, to ask questions of the speakers. We want to use most of the time to listen. This is a listening session, and the purpose isn't to necessarily respond, but we will take notes, and we've really appreciated the opportunity from hearing from everybody that has spoken to date. As you can see, the session is being recorded, and that will help us to be able to go back to review comments that are made and so forth. So what I'm going to do now is ask each one of the, and I'd really love to get Eileen up here, but is to ask each one of the commissioners to introduce themselves, and then we'll go to the speakers, and then we'll open it up. If you haven't signed up yet, please do. And so far, folks in each one of these sessions have been terrific about keeping their comments to 3 minutes. The purpose is to allow enough folks the opportunity to speak. So does this just unclip? I hope. I'm going to hand it this way. Okay.
Great.
Thank you, Steve.
Thank you. Steve Silvera.
Hi, I'm Karen Conard. I'm the Executive Director for the Merrimack Valley Planning Commission.
Andy Hoagland, a selectman and part of the Massachusetts Selectmen's Association. Tim McGurthy, I'm the Executive Director of the Worcester Regional Research Bureau.
Rebecca Davis, I'm the Deputy Director of the Metropolitan Area Planning Council.
Good afternoon. I'm Eileen McInerney, President of the Mass Taxpayers Foundation.
So before we begin, Abby, should we cue the video? Sure. Okay. Thank you.
Transportation in the Commonwealth is not important for what it is, but rather for what it does. Gets people where they need to go and shapes the economy of communities. But transportation as we know it is changing through advancements in technology like ride-sharing programs and autonomous vehicles, shifts in the state's demographics with an aging population, and changes in the environment with more frequent major weather events.
Earlier this year, I issued an executive order establishing the Commission on the Future of Transportation in the Commonwealth to address these and other challenges that Massachusetts may face in the future. This diverse team of 19 cross-sector leaders will help us better develop policy and make informed transportation decisions based on how changes in technology, climate, land use, and our economy will affect transportation patterns and the needs of constituents.
The governor has asked this commission to do something that is very unusual for state government. It's to look 20 years in the future. It's not looking at today, it's not looking at a year from now, 3 years from now, 5 years from now. 5 years from now for most of state government is a long time away. We're doing something that is very unusual, and to think about what the world might be 20 years from now.
It's a fascinating time in transportation. Technology is changing, the demographics of the people we serve are changing, our climate is even changing, and the Commission can really help MassDOT and the MBTA understand how to account for all those changes as we operate our services and as we make investments for the future.
The work of the Transportation Commission will be hugely influential on the future work of energy and environmental affairs, because currently transportation accounts for up to 40% of the greenhouse gas emissions across the Commonwealth. As we transition into a more electrified transportation fleet, this will be hugely helpful in us trying to meet the terms of our carbon reduction goals. The work will also help us to make the transportation network, the physical structures that exist today, be more resilient and more adapted to the forces of a changing climate.
Well, I think that transportation is really the cornerstone to our economy. You know, we have to move people, we have to move goods, we have to just make sure the economy thrives, and transportation is so critical to that. To me, the most exciting element of the Commission's work is the fact that we can look to the future and aspire to the transportation system that we all want.
I look forward to working with all of you as we build a stronger, better, forward-looking transportation system here in Massachusetts.
Share your thoughts and suggestions, and learn about our public engagement sessions at mass.gov/futureoftransportation.
Thank you. I think our first challenge is to get the lip sync lined up, but if we can do that, we can handle anything in transportation. I'm going to start with Jan, if that's okay. And so, Jan Muchler is a PhD here. She's a professor of gerontology in the McCormick Graduate School of Policy and Global Studies, and she's the director of the Center for Social and Demographic Research on Aging and Gerontology Institute at the UMass Boston. We have, as a commission, spent quite a bit of time actually on demographics, and 20 years from now, the who, what, where is very different than what it is today. And so, Professor Mutual, we look very much forward to your comments. Thank you.
Great, thanks. Can you guys see me? Want me? Is this okay? Yep. Okay. Well, welcome to UMass Boston. Closer? Okay. Welcome to our campus. I'm happy to be here today. As was mentioned, I run a center that focuses on aging demographics, and we do a lot of work on what it means for communities and how communities can plan around that. I just wanted, as they said, I have 8 to 10 minutes, and so I'm going to keep it very brief, and I really just want to make 3 points. One is to give you a little bit of information about that aging demographic piece. So the population of Massachusetts is getting older. I want to talk just very briefly about the unevenness of that aging across different parts of the state, and I want to talk about why transportation is so important for an aging population. So focusing on the first 2 points, initially in the federal census of 2010, 19%, or just about 1 out of 5 Massachusetts residents was age 60 and over, and the aging world focuses on the 60-plus population as the aging demographic. So we went from about 1 in 5 residents at the 2010 census, so that up to now we're looking at about 23% of Massachusetts residents being 60 and over, so we're approaching 1 out of 4 instead, and the projections from the Donahue Institute suggest that by 2030, so even before the 2040 time period that we're looking at here, close to 3 out of 10. So we're approaching a third, 30%, approaching a third, are going to be age 60 plus. So the first point is, as was suggested in the video, that aging demographic is a huge part of the story. Here we're focused on transportation. My view as a gerontologist is focused on anything. Whatever you're going to talk about, you need to pay attention to that aging demographic. The second point about the unevenness relates to how some communities are much older than others, and they're aging much more rapidly than others. Right now, there are a bunch of communities out on the Cape that are about 40% age 60 and over. So I know, it's whenever I say that, they say, wow. People say, I did not know that. A bunch of communities out in the Berkshires already that old. So we're talking about some parts of the state are already quite old demographically, and almost all of the state is aging rapidly, to the point that by 2030, these Donahue projections suggest that older adults will represent at least 30% of residents in 2 out of 3 Massachusetts municipalities. Okay, the exceptions are going to be Boston. It's going to be Amherst. It's going to be places where there are a lot of college-age people, and it's going to be some other exceptions, going to be places that have a lot of immigrants. But for most of the communities in Massachusetts, we're going to be looking at a much older population than we have now, and older than we've seen anyplace else. It's these kinds of demographic changes that have given rise to something that is called the age-friendly movement. The age-friendly initiative is something out of the World Health Organization. There are a lot of communities in Massachusetts that are working on age-friendly initiatives, and it's really about thinking, how do communities need to change everything they do, or at minimum revisit everything they do, to align better with their aging demographic. So for a community to be age-friendly, it needs to have features and services that align with the older population. It's going to help people be safe and healthy. Let people do the things that they need to do to stay independent. Let them continue to engage in their community. And you won't be surprised to know that transportation is a huge part of all of that. We were talking earlier, and I made the point that, there's so much in the news now about isolation and the concerns about the health consequences of isolation. And if you think about it, and you've got an older population that increasingly cannot drive or doesn't want to drive, they're going to be isolated if they don't have transportation options to get out and enjoy their lives and do the things they care about. So when we do projects around aging communities, we do listening sessions like this. And first off, we hear about cost of living. I'm frantic. I don't know if I can stay in my community because of the cost of living. And the second most common thing we hear about is transportation. What am I going to do if I can't drive? What am I going to do if I can't get out and use public transportation? I can't go out and walk because the sidewalks are so poor and I no longer trust my stability. So we hear these kinds of issues all the time. In Boston neighborhoods, we've worked with the city of Boston on their age-friendly initiative. We hear about people being frustrated that they can't get out and walk. We hear about quality of sidewalks, crosswalk signals being too brief, lighting being too poor, lots of things related to walking. And in communities outside of Boston, we hear that there aren't sidewalks at all, that they can't functionally walk. They can't use walking as transportation. They can go to the park and walk, but they can't use walking as transportation. There's no place to walk. We hear from people that they've missed doctor's appointments, they've missed other kinds of important things that they need to do because they didn't have transportation. In a lot of communities, there are no options if you cannot drive. There are no options if you cannot drive. There is no taxi service, there's no Lyft, there's no Uber, and if there are, older adults very often are not going to be able to afford them, all right? So that whole package of transportation options are really not available in many communities. We hear a lot about how older adults in Boston are very grateful for the T, but it's not always working for them. The accessibility of the T often is not what it really needs to be. They're very concerned that if they go to the T, they may not be able to get a seat, and they really need a seat in order to use the T, so that usability feature is very much on their minds. And again, we hear outside of Boston in particular, we hear people who say, if I cannot drive, I have to leave. I cannot live in this town if I cannot drive. So in places where there are no options, this is a huge issue for them, and it really comes down to, how committed are communities to their older populations. So we've learned a lot about these things, and it really comes down to improving access. When you're looking at an older population, an aging population, we need to improve access of the things that are already there, whether you're talking about walkability or you're talking about bus service, T service, train service, that kind of thing. Sometimes communities need to do more substantial things. There are places that we've talked to some communities where they have access to commuter rail, but it's easier to get to Boston than to get across town to take the commuter train. Okay, they have no options for local transportation. So those are the kinds of things that I hope that and it sounds like you all will be thinking about it. I'm glad that aging demographics is a big part of what you're thinking about. It's a very important concern. And again, I think it's really critical to the well-being of older population. Thanks.
Thank you. Does the panel have any questions before? Kirk, welcome. So does the panel have any questions to begin with? Okay. I'll start. You just at the end proposed that access, continuing existing access, is important. What are the other recommendations that you are either aware of in the age-friendly initiatives, either in this state or in other cities or around the world, that go beyond access?
You're talking about beyond access to existing
Yes.
options,
Yes.
building new options.
Yes.
Essentially,
Would you speak into the mic?
Yes.
Sure, thanks.
yeah, I think, I would say the majority of municipalities outside the larger communities really have no functional local bus service or transportation service. To the extent that they have services designed especially for older adults, it might be there might be some kind of qualifications that you have to meet, whether it's a disability or some kind of financial qualifications. The scheduling is very difficult, and this is another thing we were talking about before. That there is a culture shift implied there for people who have lived their lives in communities where they focused on driving themselves. To move away from that is a huge culture shift, and that has to be work on communicating that and working around that. But essentially, part of it is about seeing what are the options if people aren't going to drive, or if they don't want to drive anymore, but they want to stay in their communities. What are the options that are already there, and how to improve access, and how to build the options when they don't exist.
Are there communities that you think are doing this well right now, either Massachusetts or again across the country or the world?
I would refer you to some of my other colleagues that focus more on transportation on that. I think they might be able to tell you. But by and large, that's a big a big task to take on, and I think a lot of communities really are not prepared to do that without a lot of support.
Thank you very much. I'm going to now introduce Professor Karen Valentine Goins. Karen is the program director in the Division of Preventative and Behavioral Medicine at UMass Medical School. Her research focuses on increasing community physical activity opportunity by engaging public health stakeholders in transportation and land use decisions, incorporating the considerations of health outcomes in these process. A completely on-point topic. So, Professor Goins, please begin.
Okay. I'll be full disclosure. I'm actually not a professor, but I'll take it.
Oh, anybody that's affiliated with the academy is a professor for this purpose. So.
Good afternoon, everyone. I just want to say thank you to the governor and his administration and the commission for holding these listening sessions and for inviting me to speak. Just to add a little bit to the background that was given. I am a master's trained health behaviorist. My interest is in physical activity, longtime interest, but in how do you make communities places where people can walk and bike as opposed to just how do you get people to meet physical activity guidelines overall. And so for over 20 years, I've worked kind of at the intersection of research and practice. I'm currently at the medical school. Our work on transportation is funded through the CDC, so Centers for Disease Control and Prevention, a mechanism that they have for research. I've also provided technical assistance to Department of Public Health on the work that I'm going to describe. I live and work in Worcester. And it's nice to have another person up here who's actually from Worcester. Although I've lived in some other places that have achieved high-level walkable community status, so kind of lived in some different, and I lead the Worcester's first biped advocacy group. So it's sort of I'm coming at it from a couple different directions. And what I'll speak about is really about a focus on the impact of transportation decisions, specifically on health and those implications. And land use and demographic factors are really where we would have brought us to where we are in public health today. So 100 years ago, the top causes of death were all infectious diseases. The top causes of death now are all chronic diseases related to lifestyle, primarily physical activity, diet, and tobacco. And there's no need or time for statistics now. Most people have at least a general idea. But the disease burden and the associated costs really are staggering. For those not familiar with the history, the roots of public health and zoning are actually one. The field of public health and the basis for modern zoning codes were really born out of a desire to protect human health from negative effects of industrial land uses adjacent to residential areas and overcrowded housing that led to the spread of infectious disease. And the fields have really developed separately since then, really to the detriment of public health. And despite increasing recognition of the influence of the environment on individual choices, public health field has been slow to move beyond promotion of individual choices to kind of do the right thing, eat your carrots and take a walk. The unintended consequences of the hard work to separate land uses to protect humans has been creating a transportation system that discourages or even prevents people from traveling by walking or biking. And the epidemiology literature is very strong that the contribution of that daily physical activity, the day in, day out walking or biking, is huge. So two trends in the field of public health really are relevant here. The first is an increasing focus on what's called social determinants of health, which is a really clunky term for acknowledging that there are factors affecting health that have nothing to do with medical care or under our personal control. And my work at the Prevention Research Center in this space is really focused on engaging public health stakeholders on these issues, on these decisions that go on every day at the local level that affect the built environment. Sort of, the day in, day out planning board decisions, zoning board decisions, DPW decisions. The second trend in public health is a growing interest in health equity. Public health is getting increasingly explicit about the need to be open about the benefits and harms and the differential impacts on populations, including vulnerable members of communities, seniors being one group. And it's really becoming kind of uncomfortably clear that the focus on healthy communities or walkable communities is having unintended consequences, such as high housing costs, and so basically making high housing costs and availability when a neighborhood is improved in terms of transportation, such that it becomes unaffordable for people. So really, again, the work that we're doing is really on how do you engage, bring public health folks into the conversation because of what they can bring in terms of contact with populations, helping to surface issues that are important, and also helping them prepare in a way that's not in public health folks training to anything in transportation or land use. There's lots of advice out there. It's been out there for almost 20 years now about how public health should get involved, but if you don't know how to take that step, then it's going to be awfully hard to do so. And then increasingly collaborating with engineering colleagues, specifically at UMass Amherst right now, but on some tools that are available to assess the health impact of transportation decisions. Right now we're working on one that's really about scenarios, different choices and scenarios, but ultimately to be able to weigh at the project level. And building that collaboration because we speak different languages and it's just really important to go through that early bumpy process of collaboration. So I guess in closing, 2 points, one of which is kind of a question to put out there, to leave out there. Active travel, so walking or biking, is not just about a personal choice, which I think is how it's, like a lot of things in the United States, it's framed as a personal choice. But it's really your ability to do that is based on political decisions. And so the question is really, how do we create communities with true mode choice that remain affordable to a wide range of people?
Any questions from the panel? Tim, I'm going to hand this down to you.
This is cheating a little bit because I was involved in the process, so I kind of know where Karen might go with this. But Karen, you talked about kind of the issues of collaboration and kind of coordinating with people from other fields. And as we look at the future of transportation and the changes that are in line in transportation over the next 20 plus years, it will require adoption of new policy and new thinking at not just a state level, but at a local level. Can you just kind of highlight what are some of the challenges you see for communities to rethink how transportation fits within their broader strategies, and how our recommendations relating to what we do today to get to that different tomorrow have to be introduced at the local level in order to kind of get buy-in and support and a change of practice today to accomplish a change of policy for the future?
Sure. So I think I'll answer that with 3 of the challenges. I would say that the first is cost, because that's the first thing communities are going to bring up. And I guess, but that is, I don't allow that as the only answer, because how you spend money is a reflection of the community's priorities, but it's not something that we would ignore. I would say another challenge is culture, and that includes on the administration side. Now, I work in a city environment, so I'm going to refer to administration in sort of in that context, but it's true in any municipality. So the folks in transportation or public works departments have often been the sole deciders of certain functions of transportation, and it needs to be a wider conversation. But there's also a strong need for culture shift, for public education. And one of the pieces that I think a lot of folks who, there's always going to be people who won't walk places or won't drive places, but having a true mode choice and shifting some of the public to different modes benefits everyone. And so I think that's part of the public education piece. And then, and I guess just to make that, not just the public education part, but that it, I think European cities bear this out, that the greater, again, the greater proportion of the population that's making certain trips by walking or biking improves the experience of driving. It reduces congestion, it reduces roadway injuries and fatalities, and so those benefits need to be more explicit, made more explicit.
Any other questions from the panel? I'm going to ask my similar question. Are there, and you just mentioned some European cities, but are there places that you think are models for us to be looking at to address some of the issues that you raised?
There definitely are. I think that, well, a couple of things. One is, of course, people default and think of the European cities that have just made huge strides in creating multimodal cultures. There are also obviously communities in the United States that are very walkable. By and large, those communities are very expensive and somewhat exclusive. And so I think that, for instance, the work that we're doing, we're focusing on those communities that are not at the top. They don't need any help with it. They're already leading the way, but how do you do it in the more middle ground communities? But I'd be happy to, like my colleague, connect you with those examples. But I would encourage a consideration of not just everybody's favorite examples.
And do you have any proposed first steps that are helpful for us to be thinking about?
So from the commission perspective, or from the sort of the ground level that we work at?
First steps that you would recommend for a municipality to undertake or the state to undertake?
So, well, there's two answers. One, I mean, in Massachusetts, because of the transportation reform, there is the Healthy Transportation Compact, and that is there is work going on at the state level between the Departments of Health and Transportation, and that's an ongoing process. And I know that the Secretary's been very involved in that. At the local level, a part of what we work with people on is just the getting to know you part, and for the making processes as transparent as possible. The Complete Streets program that the Mass DOT is implementing is going a long way toward changing the system. All across the country, communities that have passed Complete Streets policies are facing the challenges of implementation. That it's great to pass a policy that looks good on paper, but the implementation gets really, really messy. So but again, transparency and it's a funny word to use in this context, but humility, because it requires learning by everyone.
Yeah. Yes, Kirk, go ahead, please.
I'm curious. I think I can project.
Yep.
I'm curious about your research or your thoughts given health disparity issues as they relate to transit. And can you speak at all to various more endemic issues in low, moderate income communities, and or have you looked at how they're impacted by transit choices and optionality?
So transit specifically, I guess, or you're saying transportation choices generally?
I'll give you an example. We have a hub-spoke transit system in Boston. Obviously, if you're between the spokes of the transit line, you have some modality choices or options. Maybe there are more options available depending on your income bracket, or maybe health is impacted in those zones because they happen to be a combination of both low, moderate, and also less accessible. And so I don't know if that's part of what you study.
It's not part of our work directly. As I mentioned, the health field in general is focusing more on those disparities. I also live in a community with a hub and spoke system, and I was explaining to Jan that yesterday I gave someone had taken their child to a sports practice. They'd traveled 2 hours each way because of the way that the limitations of the bus system. So, sort of speaking away from the current research that we're doing, sort of wearing one of my other hats, would be that when you think of that hub and spoke system, that we need to be creative about ways to create cross connections, knowing the limitations that the RTAs have for funding, and that is probably not going to change dramatically. But how can you, I'm always amazed by the number of people who are waiting here when really their destination is only here. Helping people to understand the scale of walking, what might be possible. In Worcester, we have a dockless bike share that was introduced. How could that be woven in?
Thank you. Thank you. We're going to move to the next part of the meeting, and that's for the folks that are here to actually address the commission. Don't expect that we'll engage in conversation. We really spend time deciding what to call these sessions, and we really are here to listen and to take notes, and we might ask a follow-up question, but please don't expect that. I'm going to be pretty ruthless to keep each speaker to 3 minutes and not more. And For those of you that signed up, you will go in order. Whoever has a number 1 will start, and then guess where we go from there? We'll go 2, 3, 4. And if you haven't signed up yet, you still have the opportunity to sign up in the back of the room. So if you could please introduce yourself and introduce say either whether you're with an entity or on your own. And I do want to remind you that we're not here to hear about projects. That's probably the biggest message. We really are here to hear your thoughts and potential recommendations for what we should be thinking about for 20 years out. Thank you.
Hi, my name is Mike Stanley. I'm the CEO of TransitX. I live and work in Boston and Alston. It took me 25 minutes to get here on a bike, an electric bike. So you've been tasked with developing a handful of possible scenarios, and I'm assuming most of your scenarios is going to be assuming a multimodal future, and one that heavily depends upon public funding and depends upon the road system and the existing mass transit. And I'd like to present a scenario that is now playing out in dozens of cities around the world today. TransitX is creating a privately financed fleet of fully autonomous, fully automated electric vehicles that are ADA accessible, resilient, and provides independence for both seniors and young, and reduces the cost of living. So this is a solar-powered, sustainable mass transit system with the cost, capacity, and convenience to replace cars, buses, trains, trucks, ferries, and regional flights. So this is for entire metro areas, so disabling and dismantling the hub and spoke system, giving you a sparse road network. We've reduced the cost of providing transportation infrastructure to the point where this can be privately financed. In fact, not only does it not require government financing, but we pay the government 5% of gross revenue. So I've been traveling around the world to probably 15 countries over the past 6 months and gotten a tremendous reception. People believe that now Boston is going to be the hub of this innovation future, because Boston has led, in fact, the first subway system and Zipcar and others. And I can tell you that instead of looking external to solutions, to look internal, that the solution might be handed to you on a silver platter, and that you're looking at a silver bullet of transportation, one that doesn't require a multimodal future. People want a single seat, convenient, non-stop way that works for both young and old, and that's what we can do. So this represents the lowest risk option of us moving forward. Leominster is moving forward with this with a 37-mile network that puts everyone within a 5-minute walk. We've signed a letter of intent with the Colorado DOT to study proposal. You can see more than 600 proposals we have created around the world at transitx.com/proposals. So cities are moving to the notion of a car-free world using a fully automated level 6 autonomy system. So you can have multimodal of walking, bicycling, pods, and planes. So that's what's happening. This is happening. Our demonstration will be at the end of this year. Our first deployments will be next year. And I know this forum doesn't necessarily provide the opportunity to ask questions, but I would encourage you to contact me at mike@transitx.com. I can lay out, I can answer every question that you have about how it's financed, about how we deliver it, about the capacity, and that's what we're doing. So thank you very much.
Thank you very much. I think I believe the second participant is no longer here, so we're going to go to number 3. Then we'll take the numbers from there. Thank you, Mike.
Hello, my name is Rachel Stark, and I'm the founder of Walking in Arlington, which is a community-based local walkability group in Arlington. I would say that people are starting to get over sprawl. By 2040, I think they should have completely recovered from the suburbs, and they should have recovered from sprawl. It will pass into history. By 2040, I think the cities and the streetcar suburbs will be where the cool kids want to live. That's already starting. We're seeing it. Places like Malden, Medford, Somerville, Arlington, Brookline, Boston, Cambridge, Revere, Quincy will be where people want to live. The sprawling suburbs will be history. The streetcar suburbs are moderate density, mixed use, walk to transit. They worked beautifully in 1840. They worked in 1940. They'll work in 2040. We should invest in the transit-oriented development that we already have, that was given to us in the 1800s. We don't really need new. We already have it. If we put things closer together, people have less need for transportation. That's much more basic than any transportation, is to get rid of the need for transportation by shrinking distances. A major focus of all of this work should be walkability, moderate density, mixed use, buses, trains, bikes. Let's support density and mixed use and walkability. Let's stop subsidizing sprawl by spending so much on roads and on parking and on cars. If they want that, they got to pay their own way. Give us access by proximity and walkability, not by any other mode of transportation. We don't need it. So, thank you.
Rachel, thank you. Participant number 4. Number 5.
Good afternoon. My name is Howard Muse. I live in Arlington, Massachusetts, and I'm retired now, but I did work in transportation planning for my career, and I am currently the chair of the Transportation Advisory Committee in Arlington, but I'm here to speak on my own behalf. I understand that you're looking at the year 2040. Maybe I will or will not be here at that time, but with any luck. I think you really need to think about what you want, some goals for the transportation system. Is it going to work better than the one does today? Or are you going to try to minimize the further deterioration of the system? And I mean that in terms of how long it takes to get between places. I really think that in Massachusetts, if we don't address the transportation problems and housing cost, we're going to kill the goose that lays the golden egg here. The economy is not going to keep flourishing if people can't get around, if we can't move goods, if people can't afford to live here. I think one approach that might be taken is to really take a close look at our zoning laws and have the state take a stronger hand in increasing higher density housing. Things like, I'm not sure I'm using the right term, but accessory housing like granny flats or whatever they're called. I think those kinds of things can help very much with transportation. They also will contribute to the housing issue to some degree. Your first speaker here, I don't quite understand what he's talking about, but if everybody is moving around in individual vehicles, I don't see how that's going to possibly work. I really think you're going to have to go to a much more enhanced mass transit system, better pedestrian access, better bike access, those types of things. We can't build more highways. We might be able to eliminate a few bottlenecks, and the state seems to be very slow doing that sort of thing. We have the I-93, I-95 interchange in Woburn that's been talked about for years. It's impossible to get through most of the time. I don't know why the state can't get things done. The last thing I would say is we need to put money into the system, and we need to get away from, I think, although I think the administration has done a great job in improving the delivery of services and so forth and reorganizing the system, you're not going to really get a really first-class system unless we put money into it. And I don't think at this point the money we're putting into it is going to get us to where I think we would like to be in 2040. Thank you.
Thanks very much, Howard. Number 7.
Hi, my name is Heather Hamilton. I'm a select board member in the town of Brookline. Actually, my comments are very similar to Mr. Hughes. I see kind of a perfect storm happening, and Brookline is probably just a microcosm of that. We have a lot of consumer demand for residents on top of transit. We have a great transit network in Brookline. We have a lot of developers that are anxious to build even more. And we have a select board that is amenable to changing our very antiquated zoning to allow for more density. The problem that I foresee is we may be victims of our own success. We're going to dump more people onto an already challenged transit network. And so my plea to you all is to figure out how can we capture some of this economic boom and transfer that into the T so that when we do introduce more users onto the Green Line, there is enough capacity to accommodate everyone. Thank you very much.
Thank you, Heather. Is there another speaker interested? Yes, please come up. Oh, okay. Let's do number 6. Okay, my apologies. It's the higher math for me that I have a problem with.
It was convenient that you skipped because I actually wasn't prepared to speak, but I felt compelled, so jot down a few comments. So skipping me was useful. I'm Julia Wallers. I am with the Institute for Transportation and Development Policy. We are a nonprofit that promotes sustainable and equitable transportation projects worldwide. I am thrilled to see this focus on demographics as we look towards the future of transportation in Massachusetts, and more importantly, that it's being done through an equity lens. In the Boston area, we know that we are limited by our hub and spoke system, and that our most vulnerable people, low-income people, seniors, people of color, are the ones who are most dependent on transit. And that the form of transit that most effectively fills these gaps right now is buses. And is unfortunately the bus service that tends to suffer the most. Some of you may be aware of the enormous momentum right now around bus priority, bus improvements. Boston recently just finished their very successful pilot of a dedicated lane on Washington Street. Everett has had their dedicated lane on Broadway. Most recently, they just developed a platform for level boarding. We've got Cambridge and Watertown doing a dedicated lane with transit signal priority. Arlington is doing the same thing. So this momentum is huge, and I expect that it's really only just the beginning. Some of us are even using this hashtag Year of the Bus. And the impact that we can have on people's lives and filling these gaps and meeting the transit needs of our most vulnerable, this booming senior demographic specifically, I would like to suggest putting a strong focus on bus priority, doing things like allocating street space for buses to run more smoothly, particularly during peak times, transit signal priority platform boarding, which has an enormous benefit on people using mobility devices to enter the buses at the level, just like you would with a subway. The impact is enormous. And you know what? These are all features of what we purport worldwide known as bus rapid transit. So please keep that on a list of things to pursue. I won't name any particular projects, but wanted to get that on the record. And also to add that buses can also be made autonomous and electric. Thank you.
Thank you. Do we have, and this is true for all of the speakers, do we have your contact information?
Signed up.
Great. Okay. And that would like that to make sure we have it for all the speakers. So I thank you. So Abby just did the math that she does to her 2-year-old. So we're on number 8. So thank you. Thanks, Abby.
Well, I've got a little prop because I wrote this cool little electric scooter here, which is a wonderful first mile, last mile solution. Folds right up. It's fantastic. But my name's Elijah Plimisser. I work for Smart Growth America. We're based in Washington, D.C., and I work for the Locust program. We try and encourage, we're a national coalition of smart growth real estate developers. We try and encourage walkable, TOD-oriented neighborhoods. So I wanted to just make a few comments other than my plug for electric scooters. So even though they're a nuisance somewhere else, they could be pretty useful here. So on the first note, I want to urge the state to prioritize multimodal infrastructure to establish basically better degrees of parity between how we fund automotive infrastructure and how we fund bike, ped, and other modes of infrastructure. The next thing is to take advantage of some of the federal resources that are at our disposal. One of the policy priorities that Locust helped introduce legislation for in 2015 is an amendment to the FAST Act and the RIF program and the TIFIA program. That opens up public financing to private developers if they make meaningful improvements to transit infrastructure. So that'll cover up to 75% of total development cost for a heavy rail project if it's within a half mile and makes those significant improvements. The TIFIA program, it's a lesser percentage and is for subway and bus infrastructure. So that's one resource that I'd encourage to share because it expires in 2019. Another issue is cost of construction labor. So really thinking about workforce development, how we can create pipelines for skilled tradespeople, both in the construction for housing, but also in transportation infrastructure. This relates to some of the cost overruns I feel that we have. The Green Line in Somerville extension might be an example that we've all heard of. Someone mentioned these great stations in Brookline. Most of them are just awnings. There's no reason why the Green Line extension in Somerville can't be sort of value engineered in a similar way. The North-South Rail Link, I think, is something worth exploring. I'm not the first person to bring it up. And on the point of equity that Julia raised, I used to commute to Chelsea and Revere every day from Somerville. One of the most frustrating things is that there's not a good link across the Mystic River. There's not a good east-west connection in our city. And what you find is that a lot of those folks that are sort of lacking in those equity indicators, they tend to live around Route 16 and the Mystic River Parkway, yet we don't allow buses on most of DCR roads. Route 16 is a perfect opportunity because A, it's already backed up with traffic anyway. Let's not pretend like we're conserving the environment along the Mystic River with that amount of car traffic. If we could add bus infrastructure there, that would go a long way to connect the communities of Medford, Everett, Chelsea, and many others. So that is the end of my comments. Thank you very much.
Thanks, Eliza. Is there anybody else that would like to speak? It's okay, just takes a minute or two. Are there any other comments that people would like to make or questions that they'd like to raise? Well, please, yes, say your name and who you're affiliated
My name
with.
is Laura Weiner. I work for the planning department for the town of Watertown. I was very interested in what you had to say about culture change because I think that's something I come up against very frequently is people who drive their cars half a mile to work every day and then complain about the traffic and the parking. And I think the state has done a remarkable job with their Complete Streets program and like introducing a vocabulary that people can understand, an easy phrase. And I would love to see more of that in the future to help, I understand the value of the infrastructure, but there is also, when you're talking about an aging demographic, that's the demographic that's the hardest to convince to walk or bike or get out of their car.
Thank you, very helpful. Does anybody else wish to speak? Please, yep.
Hello, is this on? Hi, I'm Catherine Carlson. I'm the Director of Transportation at A Better City, which is a business association in Boston, and we work on issues of land use and transportation around the area. We know many of you. Thank you so much for having this listening session. I think what many of us are very excited about this commission is the idea of thinking, what technology is coming down the road, but not how is the technology going to necessarily affect us, but how can we use that to reach some end goals? And what I was struck with the demographic and healthcare comments we heard today was, it is most likely by 2040, and we've heard a lot of experts say this, that we could potentially have fully autonomous vehicles driving everyone anywhere they wanted to go, which would certainly help in some of the aging communities. But then you think about the healthcare issues that were brought up. And while we could have technology do that and drive everyone door to door, is that the goal we want? How does that impact the healthcare and obesity issues we already have? Likewise, we could probably have autonomous vehicles driving everyone happily, individually, again, door to door. But what does that do to our streetscapes then? And what does that do to the public realm? realm that we want to use. And so I'm encouraged, and I'm just hopeful after listening to this conversation that we think not just about, as you said, the projects and what could be done in the next 25 years, but if our goal is a healthier society, true multimodal choice, increased public realm accessibility, then it's not really about what the future of transportation technology is, but really how do we as a society want to use that. So I would encourage you, and I think you already are, but I would encourage you that kind of be the goal of how we look at this. So thank you so much.
Thank you, Catherine. Would anybody else like to speak? Ask a question, make a point, please. Yep. And reintroduce yourself
Okay, yeah,
if you would.
I'll speak with another hat. I'm Julia Wallers. I'm also the chair of the Transportation Committee in Winthrop, and we're one of those communities that has a complete streets policy that has not been enacted in any way, shape, or form other than that it's a policy, and we got a grant to do a project we haven't done yet in one particular area of town. And I'm working very hard to create buy-in amongst the people who actually implement these projects, because I really believe that complete streets are where it's at when it comes to making our streets accessible and walkable. And actually, what was the quote you said about the ability to walk or bike is not just a personal choice, it comes from a political decision to even make that choice available to you and to sort of create that culture and that sense of buy-in. Is there any way that that the state could offer more training sessions and more aggressive outreach to smaller communities or communities in general to bring namely DPW and the police force on board with why this is important, why things like raised sidewalks or intersections and traffic calming is not just going to be a pain in the neck when it comes to plowing or add one more layer to their already complicated job, but actually make the community better and maybe even make their jobs easier. I think that would go a long way in making complete streets policies take action, actually resonate and become infrastructure. That would be great. Thanks.
Thank you. Last call here. Okay. I want to point to the website, which was on the video. And Abby, do I have this right? It's Future of Transportation at state.ma.us. Is it future.of.transportation? I don't think so.
I think it is. Yeah,
it is.
You can also contact us through the website, which is mass.gov/future of transportation.
So Future of Transportation will get you there on the mass.gov site. Well, thank you very much. I do want to thank UMass for organizing this, and I want to thank our speakers, and I want to thank each of you that actually took the time to come and listen and to provide us your comments. We are definitely open to hearing what you have to say, and everything is read many times by a bunch of different people. So thank you, and this is the conclusion of the session. Thanks very much.